Okay, here we go. And as the moderator, I would actually like to open up the floor to take a few questions before um, and see where they align with the questions that have already been stated by our panelists and then the additional questions that we have. So if people would like to go to the mics and if on either side. We'll start on my right with Steve.
Thank you very much, and thank you to the panelists for the presentation. Steve Morrison from CSIS. If you put yourself in the seat of an appropriator in the Senate or the House, in the midst of the current budget turbulence, and that the expectation that that turbulence is going to continue into many years, and there's going to be retrenchment and contraction of all sorts of budgets, and a 5% across the board on the non-defense, including the foreign aid, 9% on defense appropriations. If that member of Congress read this report and heard that sustainability or transition is no longer an acceptable concept for talking about how partner countries are going to make higher commitments budgetarily and politically going into the future, and that we're really talking about a process versus a set of goals that's going to take a very long period of time, and there's no real clear set of objectives or indicators or measures of country ownership that are identified here. Don't you think that you're leaving yourselves a little bit vulnerable to the allegation that you've really punted on the biggest issue that's in front of Congress today, which is how do we go forward selling to the American public a continued $6 billion a year commitment while we're cutting defense by 9% and we're cutting all other accounts by 5% without insisting on some concrete measure of what this transition is supposed to look like. I understand all of the different multiple reasons why this is a very sensitive issue and why you want to choose a set of terms that are more appropriate for that dialogue. But what it looks like, I think, for that member of Congress who's an appropriator is that you're punting and you're resorting to more obscure language versus more specific language. And you're leaving it to the politicians to try and figure out what is real transition going to look like. Because at the end of the day, there's going to be very hard choices made as to winners and losers in this process. And those that are good performers on upping their budgetary commitments, upping their political commitments, are going to be the ones that are going to be rewarded, frankly, I think, unless you have some geostrategic significance that offsets that. There'll be some other factors other than demonstrated commitment. But I think we're in a period right now where these kind of hard-nosed questions are front and forward, and I think harder language and harder consideration and a move towards some form of measurement is warranted. And that's just my first reaction to this sort of thing, because I think members of Congress are going to be looking at this report and saying, what's the guidepost? What are the milestones? How do we think about the future? And how do I make the case to my constituencies that the continued high investments are worth it if there's no clear vision of where that leads over a 3, 5, 10-year period of time? Thank you.
Thank you. May we take a question from the left, please?
Yes, again, John Osika from Apt Associates. My comment is, first of all, to thank the IOM for the recommendations. 10.1 and 10.2 are all very good recommendations, and my comments relate to them. Number one, when we are talking of building capacity in the long term, what type of capacity are we talking about building? I want specifically to mention the capacity to provide evidence for planning the sustainable management of the response. If the countries are going to plan the sustainable management of the response, they need evidence to do that. Where is the capacity in these countries in order to provide this evidence? PEPFAR has been providing this evidence, but what's the plan for us to strengthen that capacity in the countries to be able to provide that evidence? The second one, also in agreement to the recommendation 10.1, is in terms of the infrastructure that PEPFAR has built on in all these countries. And I'm happy we have somebody from Guyana, because we did the HIV/AIDS sustainability analysis in Guyana and the challenges that they had. I remember the then Minister Ramsamy complaining about the good infrastructure which has been done by PEPFAR, but then he was supposed to take it over in a very, very short time. So the recommendation about taking a long time to build this capacity is really very important, because there has been a lot of good infrastructure being built by PEPFAR in many countries, and probably Guyana is much better than some of the countries in sub-Saharan Africa, whereas they cannot on their own take over this infrastructure overnight and sustain it going forward. So we need to have a good plan to take over this very good big infrastructure, but which may be too heavy for the countries to take over in a short time. Thank you.
Thank you. Another question, please. See, I'm going to try to pack them all in, and then we'll talk about them for the time remaining.
Thanks very much for the presentation. My question is for the eloquent speaker from Guyana, related specifically to her concerns related to civil society organizations. And I think this is something that I've wondered as well, and I'd like to hear your thinking a little bit more deeply on this. As we, as we heard earlier, our Congress is the one who sets the funding limits, and it's way above our pay grade as to where our funding goes. So there are going to be countries that are losing money, and it seems that the replacement of PEPFAR funds can't come from too many places. And so the role of government in funding civil society becomes one of the realities, it seems. And even that may be difficult, as you said, in a place like Guyana. So my question is, how do we go about looking at sustainability of civil society beyond PEPFAR and beyond government? Because I do understand your concerns. Civil society is an independent voice, and by government funding civil society, you lose some of that independence, clearly. And I guess the question isn't related to specific civil society organizations, but more the civil society sector. So as we're looking at sustainability of countries and transitioning in some places, what should we be doing and what should we be looking at beyond what we're already doing to help sustain the civil society sector in countries?
Thank you. Daniel?
So 2 quick points. One, related to the last question and the speaker from Guyana. In many countries, there isn't even a mechanism for government to fund civil society yet. So before PEPFAR moves to sustainability or transition or country ownership or whatever else you want to call it, there needs to be some mechanism to even frame the conversation, particularly for vulnerable groups or those regarded as outside the frame of what government will pay for. Because what we see instead is a number of governments saying, great, fine, we're looking forward to PEPFAR's departure, we will consolidate what we think is important and get rid of some of these pesky civil society organizations. The second point has to do with how PEPFAR communicates about transition or sustainability or country ownership, because the truth is, in practice, different country teams have understood this in quite different ways with quite different results. And it is sometimes the case that country teams themselves have regarded this as a signal that they will go to zero or graduation or any of the other euphemisms that our panelists used. And you've seen interruptions in scale-up of treatment, even in low-income settings. You've seen people spreading genuine anxiety that basically it's all going to go to the government in a short time. And I think there needs to be some attention to framing the discourse that comes from OGAC and this report, and really being conscious of how country teams are expected to understand that, given that when you're far away, things can become distorted. Thanks.
Wow, thank you. If I may, I would like to start the questionings to Desiree, because a couple of interesting things have come up, and perhaps after you respond, we can then turn your question that you had about how PEPFAR can help civil society sector in countries. But we just had two related questions: is how do we go about thinking and looking at sustainability of the sector as opposed to organizations? Your comments made it very clear that there is certainly a reduction in the number of organizations in the country from 20 to 7. So there is something about getting rid of, as you said.
Yes.
But also, could you talk a little bit about the fact, in your presentation, you identified that from the very beginning, it was a response focused in the civil society sector, and your concern was represented as really sort of the funding going, or the lion's share of the funding going and transitioning to a government response. So if you could just elaborate on that and then incorporate answers to their questions, and then we'll come back to what PEPFAR might be able to do.
Thank you, Kimberly. I just wanted to say that the first time government started to engage civil society, it was more like an attack as to civil society not having accountability. And I think that made civil society like drift away a little bit. They're like, well, you want to collaborate with us, then you can't just come attacking, telling us that we don't have proper accountability. And so from the inception, there was a problem with that collaboration, and it went away. And now that it's coming back full circle, we, under the PEPFAR project, formed ourselves into an organization called NCC, the Network for Community Commitment, so that we can have one voice, so that we can, if there's force in numbers. And that was one of the things that we did, wanted to get it registered as an entity that can access funding, an entity that can represent civil society. But it was only an organization for civil society working with HIV and AIDS in Guyana. It started from the inception with the USAID project, but it was a steering committee. When it became PEPFAR, it became the NCC. We're still that body. We're now finalizing our registration. We are recognized at the national level. I'm the chair of that committee, and so I sit on every committee that the government has. I ensure that I do, to represent civil society. But it's only to be a part of. We feel that if we are a part of, when the decision is made, then we can be a part of the decision making. It has not been that way all the time. Government has not really been targeting the most at risk population. It was done by civil society. But we give our reports to them every month. So when they report what we report, not necessarily what they do. But I don't worry about it, because I say it's in there. Our reports are in there, and for me, it speaks volume. So that is what we're doing, hoping it will work. That's the only thing we can think of. The fact that they talk about us and put us in documents mean that they have recognized us. We still need funding to really make that a powerful body. We need our own office, which we don't have. We use each other's offices and rotate the meetings at our offices, but we need our own space. We need someone to be there. If someone wants to reach any one of us, then they should have a secretary or something. So that is what we have done to do that. I wanted to talk a little bit about this most at-risk population, because in our country, it's against the law. Homosexuality, well, buggery, and commercial sex work, prostitution. And even though they don't pick people up off the street and lock them up, it is their haunting that can be used just in case. And that bothers us a little bit. We're right now fighting to see how we can repeal it, working on it. I'm working on a presentation I'm going to do when I get back to Parliament, because they've invited us to present on our takings on it, to hopefully change that. But again, I say, when the funding goes, because most of the funding that is done with work with the most at risk, the key populations at high risk, increased risk, comes from external donors and not from the government. And the work that the government does with the population also comes from external donors to the government. So all the time. So we're saying, I'm feeling that if the funding goes, then that work will go. I'm going to be honest with you when I say we're an arts-oriented organization. We're artist indirect support. We want people to know that we were dealing with AIDS, so it's AIDS, artist indirect support. But if we have to do work in the arts to sustain, it's not going to be to work with the key population at high risk. And I have to be honest here, we want to work with youth. PEPFAR is not funding youth in our country in school program. That's what we want to do. And so we're going to have to shift, unless government decides they're going to fund the key population's high risk. And on that note, I still want to say that 50% of the global funding has to go to the key populations at increased risk. That is they say it must happen. And so this year, there's a lot of focus. This proposal, has a lot of focus on the key populations. We're still to wait to see what will happen if the proposal is approved. Thank you.
Thank you. So and I think another dimension that you just added in terms of the sort of the multiple roles that civil society sector plays, you've also now added something in terms of policymaking and changing laws and really trying to affect the availability of services and the populations that can be targeted.
I just want to quickly add one thing, that when the Global Fund funded Guyana for health system strengthening, a proposal was approved, but the health system strengthening was done with the government entities. And so civil society did not benefit from the strengthening of our health systems. It was just government. I just wanted to say that.
Okay, thank you. Well, John, you wanted to know how she was going to bring some comments from the last session into this session. That's certainly one of them, but would like to offer an opportunity, Martha, if you would like to respond to Desiree's concerns and questions.
Thank you very much for clearly articulating your concerns. And I think that this, for me, gives me even more evidence that each country has such unique concerns and needs that we have to sit with each country and figure out what is going to be important, how to make sure civil society is engaged, because governments cannot do it by themselves, and there's also private sector. So I think that's very, very important. And when we talk about capacity building, we are talking about strengthening the capacity of civil society to become more sustainable. But I think Ken's question's a good one. Where will that funding come from? If we can't convince governments that the work that you do is so critical, I think that is very important for us. I think this whole idea of readiness, where is the readiness? Have we shown the readiness for certain transitions? And will there be areas that will continue, that we will continue to have to support, such as the areas for key population and civil society? And these are kind of the difficult conversations that are going to happen. Because as I think my friend from CSIS mentioned, the rubber is going to hit the road. Congress wants to know, how are we going to progress seeing host countries begin to invest more in their own HIV response, and that our good work that we've done together, maybe now we can begin to reduce some of that investment, because that initial investment is very expensive, but over time that should decrease. So we do have to have measures of that, and showing the host country is coming to the table, putting in more of their resources, and we have to measure that and be able to show that over time. So I think that in terms of measurement, that's probably going to be one of them. We haven't solidified our measurements exactly what but we will have to keep, have some kind of measurement of that political commitment and stewardship, and financial management is going to be very important. But for me, one of my concerns is that governments recognize the value civil society brings, and that we show that with evidence. And from a public health perspective, as you said, we may have laws against men who have sex with men. They may have laws against, sex work and IDU. But the response that we're all doing at this point is a public health response. And so how do we get beyond that and away from that as much as possible? We're not going to be I don't think we're going to be changing laws, but we certainly want to, maybe government, we can convince governments to change because it's good public health sense. So, and I just recently went to a country where that was the way they were able to get around those kinds of laws. So I don't know.
Thank you. I promise we will come back to the issue of capacity building and absorptive capacity of infrastructure that was built, but I'd like to find out if the committee, and even if there are people in the audience who would like to respond to the thread of Steve's question about the need of moving towards metrics and measures to be able to convince appropriators that this is an appropriate initiative to continue and maintain while other programs are facing budget cuts.
I guess I'll take a stab at it. Marta mentioned the four domains of the measures of sustainability, and I think our report was calling for better attempts to measure those, as well as, because that would be in general what a country is doing, but as well, what does the U.S. government, PEPFAR, or programs contribute to that? So when we talked earlier today about the different understandings of contribution as this the kind of support changes. It's not direct provision of services anymore. It is the measures of what the PEPFAR initiative is able to contribute overall to the country programs. And I think the working out of the metrics for that is very important. We called for it, we didn't do it, and perhaps you would have liked us to go the next step to say, well, here's exactly what you need to measure. I think the other that was just alluded to is better information on the finances at the national level as well as the international contributions. And I think this has been mentioned earlier today as well. I'm sure Congress is going to look at how much money are they putting in versus how much money is coming from other sources. And to be able to do that well, there has to be a good information base to be able to, to really document it. Jen is more the expert on that than I. She may want to comment.
Just to add to, I think Steve's question, I think is really a critical one. One of the things that we went into the report, I think, at a time, I mean, our evaluation started in 2009, and that was very soon after the reauthorization, which called for partnership frameworks and this look at country ownership for the first time. And I think what we found, and not maybe a surprise to anyone working in development, that takes a long time. And PEPFAR is, in a sense, leading the way for a lot of it, although there's other precedent history at USAID and other places for that kind of change in dynamic and relationship. But it takes a long time. And as you know, South Africa is the furthest ahead in terms of agreeing with the U.S. government about that kind of change in relationship. So one of the things we felt as a committee was that it would be helpful if PEPFAR assessed each country from this perspective. I mean, right now we're all talking the abstract, but if there was an actual country-by-country assessment that assessed the readiness of each country to change the relationship, and readiness in some places, as we note in the report, could mean reduction in funding, but readiness in other places it may just be a change in the role of the USG. And it would also include things like what's the role of civil society in those countries vis-a-vis key populations or just in general, for sustaining the effort. So I think with that kind of specific assessment across the countries, or at least across the countries with the biggest investment, it would go a long way in showing Congress where those changes could be made over time. And I think the other thing is stepping back between the first evaluation and this evaluation and numerous other reports, this is a successful program. So the evidence demonstrates that, and that's one important message. And then lastly, I don't know if we say this exactly in the report, but we're still talking about an infectious disease. So removing support is not what anyone is talking about here, because with an infectious disease, that could have the opposite effect of what everyone wants. So I think those are some of the things that are messages back.
I see Ambassador Coker standing over there at the microphone.
I had a question, but it also, I think, could follow on directly from this if we're finished with the first round of questions. I'm Jimmy Coker. I'm from Department of Health and Human Services, and as Jen and Kim just outed me, I was U.S. Ambassador to Uganda when PEPFAR started. And I'm glad that you highlighted and that the report highlighted the importance and really a significant change for sustainability of the role of ambassadors and country teams. The idea that you didn't have to apply for PEPFAR money, it was allocated to focus countries, that you had to have an interagency meeting which added up to that total, that the ambassador had to push the button and say, this is our proposal. And the country operating plans are kind of near-death experience for anyone who's involved in them, because they're so onerous and so detailed and demanding. But at the same time, the COP, which is in most cases 95 to 99% approved, there are very few things disapproved out of the proposal coming from the U.S. country team, has a number of implications. It means that each of those activities don't have to be re-cleared through the government process to take place. And for those of you who live your life in the government, the clearance process is enormously time-consuming and combative. This completely sidesteps the clearance process, which is a huge asset in implementing programs. It also means that if you're having a dialogue with a partner in country, there's a very good chance that dialogue will result in a decision whether or not to fund an activity. Whereas if you're have a concept for a proposal, which then has to go to be bid and then has to come back 2 years later with a work plan from a US-based partner, it's much more theoretical that your actual partner in country is going to actually see the money or feel that there's some ownership of that particular activity. So the PEPFAR way of doing business, of involving ambassadors, involving country teams, and having the proposals come from the country is to me a huge step in sustainability. I'm sorry I'm taking more time, but I went back to Uganda really for the first time in 6.5 years with a congressional group last year. And we visited 3 sites, in Zambia, which was the first home-based urban center, Reach Out in Mbuya, a church-based, very community-centered place where PEPFAR #1, the very first person to get treatment, actually was treated, a guy who had a CD4 count of 1. And he came back to meet this congressional group. He went back to teaching high school history. He's remarried. He's healthy. He's going to diplomatic receptions. And then the third was Mildmay, which is the first place, I think, in the world where the U.S. was financing pediatric treatment. And what was remarkable about all 3 of those places was when I was there, they were run by expatriates. When I came back 6 years later, every one of them was run by a Ugandan professional. There were no expats in sight, where they each had a few dozen at first, and then maybe by the time I left, a few hundred clients. They all had tens of thousands of clients now. And the place that was doing pediatric treatment now had an adolescent group, self-help group, and support group. I mean, this is a natural evolution of institutions that are locally run there. This is not something that was imposed on them by PEPFAR, but really did enable that kind of sustainability. And I think we underestimate the story we have to tell already in terms of what can be sustained. And finally, John, you mentioned MEPI, the Medical Education Partnership. And there's another complete mind change, which I don't think people realize the implications of with MEPI. MEPI gives money to African institutions, medical schools mostly, to change the curriculum to make their curriculum more relevant to AIDS and so on. It is the African institution which has to pick the technical support they get from outside of Africa, from outside of their own institution. It is not US institutions applying to NIH or someone else for money, supply driven. I have a medical resident that wants to do this research, so we're going to see if we can find an African partner for that research. It is the institutions themselves, demand driven, saying this is the technical support we need from the US or from wherever to get our job done in terms of medical education. And I think just that mind change, which PEPFAR has instituted, could have huge widespread implications for sustainability all across the board, including far beyond the PEPFAR program. So I guess my question to all of you is the things that the reports define, service delivery, financial management, program management, knowledge management, they're all absolutely wonderful things and we're all for them. But the metric that Steve was worried about, we do have a metric. It's people on treatment, infectious, lower incidence rates and all those things for AIDS. The question is, are we going to have an AIDS outcome from those things which are prerequisites for good AIDS outcomes, which are prerequisites for sustainability, but in fact are means to an end and are themselves, if we just measured those inputs or those even results in terms of what you're defining as sustainability, I wonder if we're going to actually how we're going to know whether that's had an impact on the fight against AIDS. So sorry to go on so long, but it's good, great topics.
Panelists. Yes.
Thank you so much, Ambassador. I was in Zambia when PEPFAR started, and I had a wonderful ambassador as well. It made all the difference, I tell you. Really, thank you very much for your work and your commitment. I agree that how are we going to, in our let me go back. Our capacity building framework asked that exact same question. We cannot just do capacity building of institutions, individuals, systems as an end in itself. That is how we get to our health outcomes, and we cannot take our eye off the health impact. We must see the direct link. And in that capacity building framework, I have a diagram that says what are the activity outputs, outcomes, and how do they directly relate to the impact that we want to see on the HIV/AIDS response. If we are doing an activity and we cannot directly relate it to prevention, care, treatment, well, or indirectly to prevention, care, treatment, should we be continuing to do that? It's a big question for us. I mean, we only have so many resources. So we should be able to say to every activity that we do that somehow this is, maybe down the line, several levels, it does have an impact on prevention, care, treatment, and ultimately the reduction of new infections, as well as continuing treatment and all of the other health outcomes that we would like to see, reduced death and morbidity. So I completely agree that that has to be there. So based on this little diagram, countries have been mapping out, they've been doing little log frames of all their activities and showing how it relates directly. And I think it's been an interesting exercise for those countries that have been doing this. They really have to ask themselves some hard questions. So I think that this has been a great opportunity working on sustainability, which is for us at USAID our bread and butter. We've always thought about sustainable development. And I remember when I was in the family planning world decades ago and how we were able to actually graduate programs. We learned so much from that experience and how we had very clear measurements. What is the total fertility rate? What is the contraceptive prevalence rate? You know, we had targets, and we said, can we hit that? And then we looked at quality, made sure, is the quality good? Is there a readiness now for the host country to take this? And then we gradually reduced our inputs. We went from service delivery, as we are doing in PEPFAR, to much more technical assistance and capacity building and system strengthening, to finally just kind of giving some mentoring as they went forward. So I think we have a lot of lessons learned from the past as well. But yes, thank you. We do need to continue to look at the health outcomes. We can't let go of that.
I just wanted to say that I agree that programs that are designed by country will be more sustainable. When we started on the USAID, we had what was called the designer workshops, where we used to design our own programs with technical support from Family Health International. And then when PEPFAR came on board, it was, this is what PEPFAR wants. These are the targets. These are the areas. Let's see who are best suited to work there. Hence, people had to go because they were not suited to work in those areas. And so it's now designed by PEPFAR and not by country per se. And so that for us was, we were worried about it for sustainability, and we were worried about it that it was not going to sustain itself. So it is true to say that if the country designs the program, then there is better room for sustainability.
And I think that I would like to add sort of this theme of what is being measured and how do we sort of talk about impact and success. And one of the things that I think that the chapter tried to do and the committee tried to do is, and it is specifically in box 10-6, that there are some measures there that have been identified by the USG through an application of the country ownership assessment tool that can be used in terms of sort of short-term and intermediate and some longer-term interpretations of things that can be measured beyond financial contributions of a country in terms of where a country is in terms of readiness and where it is in terms of all of these dimensions. And I think that the committee was really hoping, while we weren't able to see, we tried to sort of look at the evidence in the Partnership Framework Implementation Plan for South Africa that was available to map them back to sort of where were these things identified in that plan and how things were being measured. But I think that the committee was really hoping to push this discussion and decision making around you have to be able to articulate what the outcomes are with clarity. You have to be able to articulate all the things that you're measuring that make more of a composite, probably, sketch of countries. And the committee is also recommending that in those countries where it's already been done, the Botswana and Namibia, et cetera, that's part of the discussion in terms of the systematic application and assessment of countries to be able to answer these difficult questions. And I would like to ask Thomas pointedly, if I may, are there things from sitting on the perspective of the NAC, are there things that countries are saying, here are things that we should be looking at, that the USG and PEPFAR should be looking at in terms of our movement and our readiness to be able to better lead this response, and going back to the discussion about capacity building for being able to plan the response and strengthening that local capacity. Are there metrics that you all would like to see be used? And if not, but are there metrics you'd like to see used beyond what is the country's financial contribution in terms of meeting its Abuja Declaration commitments?
Thank you very much. Actually, with respect to HIV, there are a lot of things that we would like to be able to do with PEPFAR. I think the first thing is that PEPFAR is one of the, I wouldn't, because in Malawi we have a system where all the monies are put in one basket. It's called the HIV pool, but PEPFAR is not part of that. So what happens is that we have now to deal with PEPFAR from a different angle. So much as we would like PEPFAR to try and harmonize with other initiatives like IHP or to join the pool, but we know that there could be other policy issues that make PEPFAR not be able to join the pool. But what it means at the end of the day is that it means a lot of work for us as countries, because we have to deal with the pool partners, and then we'll have to come back to PEPFAR and have the own requirements. And we understand the rationale behind that. But really for us, what we want is to give us that kind of time to be able to move. Because sometimes we introduce a lot of things very quickly before the country actually has planned to take them over. So maybe what is important is this kind of time, and maybe it will be good for us to plan together to be able to say that maybe if we are given this much time, maybe we'll be able to take this on board. I will give a very simple example of the Global Fund. They allowed us to put in what they call salary top-ups for health workers. So we put in something like 50 or 60% of their salaries as top-ups. And this year we were told that, no, we are not going to put that anymore. And you can imagine what kind of crisis that has caused. So all I was trying to say that let's do things together, let's plan together, and then maybe as countries we might be able to agree on when we can take over things, of course with the support of our partners. Thank you.
Make any comments? I see we have one question remaining, and we still have the floater of this issue of capacity building and strengthening local capacity for collecting and gathering and analyzing and using evidence to plan. Sir?
This is a question for the committee itself, and Thomas raised this when he talked about the swap. It's looking at the other bilaterals and multilaterals that are in country that are looking at and funding maybe very directly health system strengthening activities. When you were doing your analysis, particularly your interviews, did you find cases in which there were challenges with the way the U.S. government managed its procurement process and that it didn't allow for a better kind of collaboration or support for kind of an integrated approach with the other donors themselves? And if you did, what were some of those either procurement challenges or management challenges.
Thank you. Committee?
Well, I think didn't do is make a recommendation that that PEPFAR participate in the swap. So that's, but in visits we heard both sides of things. Some places, even members of USG said that they really wished that they could participate in the swap, that they thought it was going well in the country. Other places, we were hearing that everybody wanted to flee the swap, and it was going very badly. So,
Are you talking about procurement specifically or general?
General.
Oh,
yeah. So that's.
If I could just add on to that. I think that one of the things that we did find in our data collection across countries, particularly around procurement, is there may not have been so much success, I think, in terms of integration with other donors, but I think in terms of relating to the discussion about sustainability, certainly saw some examples where there were efforts to use local vendors for procurement, focusing on capacity building for that. It certainly wasn't across all of the countries, I think, that we saw, and sometimes it was related to the mechanism that the USG chose in terms of being able to put funding into the country, and others were just purely logistical challenges, and some were coming at it from. But even though it's difficult and a challenge, we should still try to focus on being able to move a percentage of procurement to be able to use local vendors, and even talking about that as part of health system strengthening is building that capacity for local procurement, local manufacturing, to really be able to look at reducing the cost of doing business long term. But we certainly saw variable examples of that across countries. And it's certain, and I think that that's an area that we would certainly recommend in terms of the very focused evaluations for health systems and health systems capacity, that should be an issue that should be addressed. Any other comments? I believe, Evelyn, that you'll get to ask the last question of this session.
How exciting. Evelyn Tomaszewski from the National Association of Social Workers. And so thank you very much. This is an amazing document. And I do want to really note the importance of civil society. And at times, people are so, many of us, busy working every day that we don't have the opportunity to give voice to the policy needs. So I think this is a really important conversation. I'm going to do that everything is connected moment that my people do in social work. And I went to the health system strengthening meeting earlier, and it talked about capacity to locally produce and retain clinical, non-clinical, and management professionals whose training and scope of practice are appropriate. And then here in this session, we're talking about strengthening in-country academic institutions, degree programs, long course training programs. And I always come back to the idea of health force strengthening, that I think there's a gap in our measuring of the existing behavioral health and mental health workforce. That I do know through our membership through the International Federation of Social Workers that there are many PEPFAR countries that have professional associations of social workers, psychology, nursing, that psychology and social work I'll focus on because we think of those as behavioral health professions. That have not been measured, may not be measured, but are certainly part of the sustainability and building capacity. So I'm just wondering how that might be addressed going forward. And
Thank you.
I have some of my health force experts here in the audience. You can chime in if you need to. But I think this is very, very important. When we have the 140,000 health workers that have to be attained in PEPFAR, that includes social workers and other workers that work on behavior. So that was a big, important step. It's not just health workers, but it's also social workers, et cetera. And we have great example in South Africa where they've really worked closely. PEPFAR has worked very closely with the government, the ministries that work on social service provision, and have built that capacity, and the government is taking this on very effectively. They've been building their own social worker cadre, and we're hoping other countries will take the lead, will take their lead and move in this direction, because it's been a big challenge. It's a huge challenge working with orphan and vulnerable children and other areas of care when you don't have social workers or those who can address other needs of those who are vulnerable. I think, so I'm hoping other countries will see what South Africa is doing and say, that's how we do it, and move in that direction. I don't know, is anybody, yes?
And if, please move to the microphone. We're causing a little apoplexy here in the middle of the room.
I'm with Estelle, so in terms of what we were saying about in terms of counting health workers, we from the very beginning thought very broadly about this, so that's the good news. The other thing is we've also, I mean, I've got a country example, Tanzania, where we're not only creating the workforce, we're actually working on the policy level as well to ensure that they are part of the government system or that they're recognized and that there's a professionalization of them. And then continuing education and supervision and all these other things. So it's not just we produce them and they go, but we also looked at everything else that surrounds them, you know, forevermore. So that's been a big part since the beginning. We've been very fortunate to be able to push that. So.
Well, thank you very much for all of the comments and the questions. In a second, I hope you'll join me in thanking the panel for this presentation and all of you all for your discussion and comments. And I hope that we talk about dissemination of this report, and even though it took a long time to produce it and we couldn't talk about anything for a long time, we're really happy to talk about it now. In great detail, and we're hoping that these conversations continue to happen not only with our committee and our staff, but also amongst all of the different stakeholders, and how this report can be relevant to you and the recommendations and the roles that you all play in terms of trying to improve the program going forward. And I think one of the things that I'm taking away from this sustainability section is that there are many things to talk about, and measurement is really important. And I think we've heard some really different things. I mean, the importance of capacity building at all of these different levels, and how that's intricately built to systems, and also that has to be a multi-sectoral response. And just hearing some of the concerns and remembering that bidirectionality can have different meanings in different countries. So sometimes people are worried about what the transition is happening to. It's not what we assume. And that really ultimately the report talks about the fact that a sustainable response has to happen among all of the stakeholders in a country. It is not specifically the sole or singular responsibility of any stakeholder, and depending on how your response has evolved over time and the role of the different stakeholders, it really is something that everybody sort of needs to move forward and figure out, you know, as Jenna was saying, not only how do you sustain the gains and how do you sustain a response, but also remember that this is still an infectious disease, and there still needs to be control of the epidemic in the country while people are working towards making sustainable gains and hitting the tipping point. And Deborah said earlier that this was a diplomatic discussion, and it is at a higher level than ever before. And we've heard cautions that even though it's a diplomatic discussion, it cannot be a political discussion by default, and that people have to make some real difficult choices in figuring out what are the important things that are to be measured. How do we know? How does everybody know in a transparent way what is happening and how we can continue to offer support or even change or restructure country portfolios and things that are happening, particularly if the focus is using a project impact pathway that says, how do all of these activities really relate to prevention, treatment, and care, and what the ultimate health outcomes that are desired. So we thank you very much for your time. Other groups are coming back, and which is why I'm going to wrap this up, but I'm sure if we're going to take a break until 4:15, people will then convene here in this room, and we'll get a chance to hear report backs from all of the groups, and Jen Cates will be reporting back from this group. And then we'll hopefully have a chance to ask some questions across topics, and then Bob will give us some closing remarks. But please don't let the discussion stop here today. Thank you very much.